Welcome back to Families in Action on your hometown station, AM 1220 KHTS. I'm Cary Quashen. I got my co-host Mike Doherty with me.
Hey, Cary.
Yeah.
Did you hear Pam singing that song?
I did.
I'm telling you, we ought to have a segment.
I did. I know.
The guests sing the song.
I'll sing it with them.
No.
Do you know
Come on, people now.
Do you know what it's called? Do you know
What,
who
the
sang
song?
it? Yeah.
Who did sing that song?
That would be the Youngbloods. Smile.
Not
Not the
these are
Mamas and
brother.
the Papas?
No, it's the
No.
Youngbloods.
Nope.
Oh, I would have that
But you
confused.
sang it so well. We
That's
should have turned
right.
the mic on.
Yeah.
earlier.
No.
So anyways, we're talking about with Pam Geyer from Henry Mayo, and she's involved in most of the pain management, everything for the hospital, and you wanted to go somewhere when we come back. I'm just going to hand it to you.
I'd like to make a distinction between acute and chronic pain.
Yes.
There's many different types of pain, but there's basically two buckets that really make it understandable. And acute pain would be, Mike, if I socked you in the nose right now, you'd probably say what?
Don't hurt him.
You'd say-
He's a good guy.
He'd say, that hurts, right? Why did you
Yes,
do that?
and so would you.
Yeah. So it's kind of it's the here and the now. So pain that you have from an accident, from surgery,
Right.
that's acute pain. It's something that hasn't been around. It's newly, in place. So that pain we can treat differently than what we treat
Right.
chronic
Because
pain.
it's a temporary.
It's a temporary situation, and the use of opioids for acute pain conditions such as surgery, trauma, are very effective because they're only used for a short amount of time.
Right.
In a chronic pain situation, the pain has actually been around long enough that pain nerve kind of has changed. It's been hit so many times by that painful impulse that it has changed. So it changes how it receives pain, how it processes pain, all of that stuff.
Can that reverse, by the way?
You can, sometimes yes, sometimes no. Sometimes
really?
you do have a bit of that you live with for the rest of your life.
Yeah.
Yeah, I mean, it's like nerve damage from, diabetic neuropathy in your feet
Right.
or something like that.
And we get those, and we get them people that come to our rehab, and
Yep.
they're strung out, and they also have chronic pain, so we have to treat them different than
Yep.
we treat everybody else anyways.
Well, and we found out, too, that outside of opioids, other medications, which are in a class called antineuroleptics, which really were seizure drugs, but
Right.
such as gabapentin or Neurontin, Lyrica, they're more effective for that because they're actually treating that nerve.
Right.
In there. So that does have a bigger impact than giving an opioid, which is just going to block that painful impulse
Yeah,
somewhere as
right.
it travels
It
up
just-
and down the spine.
It really just masks it.
Absolutely. Absolutely.
It doesn't fix it, doesn't take it away, it masks it.
Yeah. And that's really where that other component then has to come in, that the mental piece of this treatment is so significant. And unfortunately, third-party payers don't want to pay for that. Which is so sad that it's unbelievable that we've allowed that to happen. But you need to get into a program and through therapy understand, how am I going to manage my life with this chronic condition?
Right.
And this chronic condition is no small potatoes here in the United States. The numbers of people involved are staggering.
Well, it's different than it's ever been, because there's different and better and more powerful drugs than ever before right
Yep.
now. I was talking to one of the docs over at the hospital a few months ago, and we were talking about muscle relaxers, and he was saying, Soma, what a great drug for a week.
Exactly.
And one of the nurses says, what do you mean? He says, after a week, you're addicted.
Yep. Highly addictive muscle relaxer.
Exactly. Benzos. What a great drug if you have anxiety or panic attacks. But if you keep taking them to get through the day, what happens after a week or so?
Yep.
You get
You're
addicted.
Dependent on it. Yep.
And coming off Soma and benzos is extremely dangerous. That's like coming off alcohol. It can be deadly.
Yep.
Coming off of opiates, extremely dangerous. You might not die, but you feel like you will.
Well, and nobody should do that themselves. I mean, if you're in a place where you need that type of intervention, you need to have help of professionals.
Yes, absolutely.
And if you're a family member, please don't just take someone's medications away because you feel they're bad for them. And that happens. People
Coming
do that
off-
out of a love.
Oh gosh,
but
coming
please
off
don't
of
do that.
any of those drugs, coming off of Vicodin or any kind of codeine, oxycodone, any of that stuff is extremely painful, and you can get really, really sick, and it becomes very dangerous. Coming off of benzos or muscle relaxers can become deadly.
Absolutely.
So it's one of those kind of things where you do not want to play doctor. If you're addicted physically to any of these drugs, you want medical intervention.
Well, and the family of the benzos, the anti-anxiety medications, there are pain management properties associated with them, which is why sometimes you'll see in a chronic pain patient, they have a very low dose of an anti-anxiety medication, or they have a low dose of an antidepressant, because they also have pain management properties in them. So it's not uncommon for people with chronic pain to have those medications put together with their anti-neuroleptic, and some of them maybe have a very low dose of an opioid with that.
Right.
But by putting that combination together, we're able to keep all of the bad drugs at a really low dose and get better pain management.
Well, Cary, looking at how chronic pain affects Americans, just America now, 100 million Americans, that's how many are affected by chronic pain. And listen, 100 million Americans, that's more than those that suffer from heart disease, cancer, and diabetes combined.
So pain.
Chronic pain. Now, listen to this. The economic cost of chronic pain is very high, and that's way understating it. Listen to this. When you include healthcare costs and lost productivity, chronic pain costs the U.S. society at least, hold on to your hat, $630 billion with a B each year. Now listen, let's put that in perspective. That's nearly $2,000 for every man, woman, and child in the United States to pay that bill. $630 billion a year it's costing us in society, in lost.
Well, that's not even dealing with. That's just loss of. Yeah, that's just cost.
It's care costs, but
okay,
that's a lot of money, no matter how you slice it.
Well, it's the number one contributor to disability.
Yeah,
it's chronic pain. So when people aren't working, they aren't productive, and who has to pay for those costs? It's society.
But think it even through a little further. When people aren't working and they're laying at home collecting disability, they're also getting depressed.
Absolutely.
And what comes with depression is sickness, mental health issues,
anger,
hostility, violence, and all the other stuff. So, I mean, if you really think it through, the cost just goes up and up and up and up and up.
It does. And in fact, the coffers are running dry because disability is not going to be able to sustain, which is unfortunate because there's a lot of people that really need it, but it's being abused by people who'd rather sit at home and do
well,
what you're
and it's, I think for a lot of those folks, they don't know another choice. So it's up to us to share with them and say, you have other choices here. Now you need to make the decision. Like I had a patient tell me that, well, it's very hard to change things. I said,
change is hard.
Sure, it is hard.
Right.
But what quality do you want in your life?
Do you want to walk around like a zombie and be half present and half not on your benzos or oxys or whatever it is? Or do you want to be present in life? That's really the question. You know how many people come into our rehabs and they've been on oxys and benzos and somas and Ambien. I can go on down the list for an hour. And they come in and they're afraid to death. And when they start coming off of it after they go through their initial detox, they're going, I haven't felt better in years.
Yep.
I really don't need all this crap. I mean, I hear it all the time from people that believe they have chronic pain, and when they started when we got them off of the opiates and on an anti-inflammatory or something like that, they felt great or better.
Yep. Well, yeah, I mean, you want to be able to participate in your life.
Of course.
And what we've done to date is we put people in a place where they can't participate in their life. I don't want to fault anybody on it because I think everybody thought they were doing what is right.
Of course.
But now that we know this isn't the right choice, prescribers need to get in alignment with what the current state is. Many of them don't have knowledge. I don't know how they don't have knowledge. Their own medical board here in the state of California published guidelines to pain management,
Right.
which I don't know why they don't read it. I read it. And I think, they certainly should read that, but they need to get in alignment with this current epidemic state. I mean, 44 people a day.
Yeah.
Now, they may think nobody's watching, but as we kind of learned at our
But
conference,
when people
are watching.
Yeah, people are watching, and people want to do better, and
Yep.
and physicians and nurses really do care, and they want to make a difference. But when people hear 44 people a day are dying from drug overdoses, they think heroin.
Yep.
They think the dope fiends. Again, no, these are not the dope fiends.
Nope.
These are your neighbors. These are people that are professional people that are, for whatever reason, addicted to pain medications or benzos or whatever it is that they're addicted to.
Well,
let's remember,
yeah.
only 8,000 people die from heroin. That's a small number out
yeah.
of 43,000. It's not a small number, but it's
Smaller.
smaller.
Well, and
Correct.
if you put that in perspective to the number of people, that died because of Pearl Harbor, was it like 2,400 people? And
Yeah.
the country went sideways on that. 9/11, 3,000 people, and the country went sideways. We're talking 43,000, and people aren't going sideways. We need to get sideways about this and say enough.
Yeah.
That's really, we have to get to a place where healthcare providers need to be able to say no.
And by the way, if you're listening, I don't believe that anyone that's listening to this conversation right now doesn't know somebody that had a problem with alcohol or drugs.
Yep.
I think everyone there is knows somebody that's had some kind of problem.
Yep.
And isn't it amazing that we've seen the statistics, and we know for a fact that if illicit drugs and alcohol went away, that most of the crime that we're seeing, most of the problems that we're seeing would just vanish. In fact, I recall, as you probably do too, Cary, that date rape, 100% of the time, almost 100, let's say 99.99% of the time,
Yeah.
is drug-induced. So it would vanish.
Yeah.
But that's true. Child abuse, huge percent. Rape, molestations.
Unemployment, people would be working if these issues, drugs and alcohol, this wasn't out there for them. I mean, we would have responsible contributors to their family. Children would be being educated. They would participate in school. They would be doing those things that right now are not being done. So it's a huge issue. It's not just my family member, your family member, or a patient here, or somebody there. It impacts all of society. So likewise, all of us have a responsibility to turn this around.
And you're right when you put it in perspective by talking about, and these are tragedies, and I'm not
Yep.
shorting these, but 9/11 and other tragedies that we've had, where this country has literally just gotten up and gotten furious and gone to war and everything
Yep.
else. But here we are with 43,000 people a year dying.
9/11, we lost 3,000 something
Yep.
people. We lose 43,000 people a year
The whole
from
country.
drug abuse.
We should
Yep.
be all
Everybody
up and
should
saying,
be-
stop it right now.
What can I do?
Right.
Where do I go? How do I help? What is my part in being able to do this? Because as you know, one person can't fix it. One entity can't fix it. One organization can't fix it. It takes
I've been trying
a
for
village.
30-something years. It's
so
not
you
working.
know.
I'm
Yeah, so
still
you
in business.
Yeah, you absolutely know that. So we all have to participate in whatever capacity we can, and that education is a key component. Getting out there and educating from the school age level to on up.
Right.
I mean, we have seniors that come in that are
Yeah.
addicted to opioids. They're 68, 75 years old, and you look at it and say, what a way to leave your life here.
This is your twilight years, exactly. How can you enjoy it, being in that zone always?
Yeah, and it's very sad because people change. Their personality changes, everything about them, which from all those that you've helped, Cary, are really...
When it comes to the opiates, I mean, you can almost see it in their faces.
Yep.
When it comes to the benzos, you can see it
Yep.
in their faces, and they're kind of in that whatever altered state where everything's different.
Well, and then there's always a negotiation that goes on. And when I'm working with patients, that's where I know I really have someone that needs intervention seriously, because they try to negotiate the use of their opioids.
Right.
And when I turn it around to them and I say, listen to what you're saying right now. You're trying to negotiate a plan to obtain more medication. What does that tell you?
Yeah.
And when they're forced to look at that, they kind of have to go, well, no, that's not what I'm doing. Oh, it is exactly what you're doing.
But what you're saying is perfect where I want to go now. You have your kids that, okay, when we're young, we have contracts. When I grow up, I don't want to do these things ever. And they mean it, and then they smoke a cigarette, and they go, oops, it's just a cigarette. I won't use weed. They smoke weed because it's natural. God put it there. I just won't use any other drugs. They go to parties. All the other drugs are drugs of opportunity. They have addictive personalities, and they're off to the races, and they're drug addicts, and they're in trouble. Okay? That's how people get addicted. Then you have what we now are creating, which is what I would call, and I'm treating in my centers, and you see it every day at the hospital, we call accidental addicts.
Yep.
You want to go from there? You want me to?
Yeah. I mean, accidental addicts are unfortunately those through no fault of their own, by virtue of a surgery or a traumatic injury, a chronic illness, have become dependent on opioid use for their daily existence.
Let me just throw something in. I don't want to.
By the way, with no history of drug abuse. Sorry.
There's an interesting story, and I remember seeing an interview with Jerry Lewis, the famous comedian, and he was saying that he had terrible chronic back pain that he had to manage, and he got it because he was on stage, and he was doing a bit, and he did a pratfall, and he landed on a microphone connection, and they can't see these at home, but these are these large metal connections, and he seriously injured his back when he did the fall, and so they gave him some medication to manage it, and he literally said, I became addicted. It was terrible. Now they've gotten off of that. They give him another electronic device to help manage it, but that was easy to happen. He literally fell in the middle of doing his work, injured his back seriously, and wound up addicted to the medication.
And what happens then is you hurt yourself. They give you one of two things. They give you Vicodin or one of those codeine, oxys, whatever that is, and then they give you muscle relaxers. Now both of these things are highly physically addictive. So now all of a sudden you get somebody that hurt themselves by accident, that any type of prolonged usage is going to become physically addicted.
100%.
And then
100%.
we're dealing with so many of those right now. I'm talking professional. I've had police officers and lawyers and nurses and doctors, and I mean, you name it, in our treatment centers.
Well, and it's hard for that person to get them to the place of acknowledgement of that, because they still see, well, I got injured.
Right.
I hurt myself. This is why I have to have this, because I didn't create the injury. I didn't give myself a chronic condition such as lupus or fibromyalgia, so it's not my fault.
Right.
And it's, you have to get them away from that to understanding, no, nobody's placing fault here. What we're saying, though, is we need to reestablish a quality of life for you that is not opioid dependent.
Correct.
And that's a difficult place, and that's where the counseling for that person has to come in, to where they can sit down and they look at it and they go, gee, I am doing those things. I am exhibiting behaviors that are drug seeking and are.
I've hit 3 different doctors to get my medication because 4 don't work anymore.
I even drove to Nevada. What the heck? It's 4 hours away. I went to an urgent care there and I got medication.
I'm on a list at Henry Mayo. They won't give me any more medication because they know.
Yep.
So, and then what happens, even to take it a step further, we're getting people that, I mean, they built up such a tolerance that they can't go to the doctors anymore. The doctors aren't going to give it to them because they can check this new national cures thing and figure, whoa, you're taking way too many pills. So they go to the connection. The connection, those pills are extremely expensive, and all of a sudden somebody says it's an opiate. Smoke some heroin. It's the same high for a whole lot cheaper.
Yep.
So we're treating professional people now addicted to heroin. And we'll talk more about that when we come back from break. This is Families in Action on your hometown station, AM 1220, KHTS. Welcome back to Families in Action on your hometown station, AM 1220 KHTS. I'm Cary, along with my co-host Mike, and we got Pam Geyer.
We do, and we're talking about pain management.
You know what I want to do? Ouch, exactly. That sounds painful. I don't want to talk about pain management. I don't want to talk about pain anymore. I want to talk about solutions.
Sounds like a good place to go.
So what is where are you at right now with all this? Because you've done some wonderful things, especially here at Henry Mayo.
Well, we had an absolutely fantastic seminar in which we invited participants in the healthcare community, from physicians to first responders.
You filled it up.
Yeah, it was very, very well attended, and we had representatives come from our Department of Justice, the DEA, all of our
Sheriff's
boards,
Department.
medical board, nursing board, pharmacy board. We had yourself come as a rehab expert. We had an attorney come to talk about licensure defense.
Right.
So those of us who are healthcare providers need to understand that we could find ourselves in a position if we are not current with what guidelines are and how we're managing.
Right.
So with that education piece needs to get out there. For family members who have someone that is in this process, or the person themselves, they are more than welcome to give me a call at the hospital. I'm there as a resource. I know many great people, such as Mike and Cary, that I can get you to places where you need to be to get that help.
Right.
Or sometimes maybe you just need to sit and talk to someone, and we can take a look at what you're taking and try to figure out a better plan. There are things.
There are other plans. There are other treatments.
Yep, there that are non-medical. Obviously, counseling and therapy, behavioral modification therapy, cognitive therapy is very good. Exercise. I know everybody hates that E word, but you
Actually,
know what?
I like it these
Yeah,
days.
yeah. Exercise, you get your body fit, your core strong, it uplifts you, especially for patients that have chronic back pain conditions.
I had sciatic nerves and all, you name it, and I've been at the gym for a year, and I'll tell you what, I don't have any more sciatic problems. They went
Makes
away.
a huge difference.
Just like that.
Yeah, when the core is strong and the body is strong, it will eliminate many of those conditions, because then your body has strength.
Incredibly true.
Yep. So, we have that. We have music therapy, art therapy. There are so many things that you can do to intervene. From an intervention side, we also are using spinal cord stimulators, which do stimulate that area of the spine to kind of, almost like if anybody remembers the old TENS machines where we put them on and they go bzzz, sort of the same thing, but it's internal. So it interrupts that pain impulse, and a lot of people are having great success with spinal cord stimulators.
Let me ask you a question.
But by the way, I'm sorry, Mike, but
That's all right.
if you're one of them people that have pain and you've been trying to treat it and you've been going to doctors and you're saying to yourself, it's just, I don't want to live this way anymore. Do I have a problem? What's going on? First of all, if you have to question yourself, you probably do.
You probably do.
There's
Yes.
something going on. And second of all, if you're really tired of living that way in that kind of zone,
Yep.
in that dark cloud that's over your head, there are things you can do about it. Call Pam.
Yep.
And your number again?
Is 661-713-4309. That is my hospital cell. I have it with me all the time. Again, 661-713-4309. I'm glad to speak with you. Many people have come down and we've sat together, and I'll go over your medication list, and we try to figure out a plan to be able to better manage that. But it all starts with, Cary, like as with anything, you have to make a decision that this is not going to rule your life. Pain is not going to rule everything you do.
This what I was going to ask Pam is that once upon a time, this person that's addicted to these pain meds had to make the decision, or maybe it was made for them, but to take this medication. So how difficult is it now to get them to look at alternatives? I mean, are they willing, for the most part, to say, yeah?
Most people get to a place where there just is no quality to their life.
Right.
And when they are at that place, they are willing to look at that. Now, is it an easy transition? Absolutely not. Because now I'm really afraid that if I don't use this, I'm going to have really, really bad pain. So that fear comes in there. And that's where that counseling or becoming part of a support group really is beneficial, because then you can talk to others that have felt that same fear. And it's very real, and it's something that you have to address if you're going to take that next step to get better.
And I can promise you this, your quality of life can change dramatically if you want it to.
Absolutely.
There's so many different alternatives and options these days that weren't here 3 years ago.
Yep.
So,
And
that we didn't know 3 years ago.
And let's face
Yep.
it, we can't continue to pay $630 billion a year for this. I mean, it's only going to go up.
Mike, we can't continue to watch people die.
That's it. That's even more important.
44 people a day.
So in this last hour, how many people died when we were on this radio? At least 5.
5.
So since we've had our show, 5 people lost their lives to drug abuse.
Right.
Yep. And drugs that they didn't seek on the street, drugs that someone wrote them a prescription, a reputable way to get a medication. They went to a pharmacy, they filled it, and they took it.
Right.
So we have to change our prescribing practices.
And one thing you can also look, if you have a prescription to take, let's say Vicodin, 1 every 4 hours, and you're taking 3 every 4 hours or 3 an hour, you might want to take a look at it.
Absolutely. Please do not change your medication without talking to a professional.
Right.
Please call me if you're in that boat and where the prescription is saying every 4, but you're taking them every 2, and that's why you run out.
And please don't try to do it on your own, because most people that do fail. Just reach out and get some help. Call Pam. Call Action 800-367-8336. There's options out there. Pam, I want to thank you. This has been a great show and extremely good information, extremely important information, and it's always great having you. Isn't she great?
She's wonderful. And I work with her at least once a year. We put the Nurses Week together.
I see him like every day.
I know you guys. I say, wait a minute. Every day. So on that note, is it time for us to close? I think it is. This is what's happening next week.
Tom and Alice Reynolds of Compassionate Friends talking about dealing with holiday grief. We are in the holiday season. Cary.
We are. Hey, that's right. We're going to be dealing with holiday grief next week. This is Families in Action on your hometown station, AM 1220 KHTS. Thanks for listening. Thank you, Pam.
Thank you guys for having me.